Good morning, Chair and members. Shannon, Olivieri, Hovis with Essential Access Health, a sponsor of AB 50. Over the past 15 years, Essential Access Health has co-sponsored every major piece of California legislation expanding access to birth control, including the Contraceptive Equity Act of 2022, which took effect in January of last year and requires public and private health insurance to cover over-the-counter birth control without cost sharing or prescription. The timing of that legislation coincided well with FDA approval of the first over-the-counter contraceptive pill, Opill, in 2023. As a result of that legislation, Californians covered by private insurance should be able to access over-the-counter birth control, including Opill, without a prescription or out-of-pocket costs at their in-network pharmacy right now. Unfortunately, there are greater barriers to over-the-counter birth control access for Medi-Cal enrollees. Since federal law requires a prescription for Medi-Cal coverage of outpatient medications, Medi-Cal cannot cover over-the-counter contraceptives without a prescription. As such, when Medi-Cal enrollees want to obtain coverage of over-the-counter birth control, they have to go through the same procedures as if they were obtaining a prescription-only contraceptive: finding a participating pharmacy with pharmacists that have received the required training, completing a self-screening questionnaire, receiving required counseling, and having a summary of the visit sent to their primary care provider, all to simply access birth control that is approved to be accessible over the counter. About 1,500 pharmacies in California can do this, assuming the trained pharmacist is on shift. That leaves about 5,000 pharmacies that cannot. While these procedures are appropriate for prescription-only contraceptives, they are unnecessary for over-the-counter methods and put access without cost sharing out of reach for millions of people enrolled in Medi-Cal. AB 50 allows pharmacists to issue a prescription for over-the-counter birth control while bypassing the medically unnecessary procedures. With this simple policy change, AB 50 will expand equitable access to over-the-counter birth control regardless of health insurance coverage.